The VSG, or vertical sleeve gastrectomy, is a weight loss procedure in which a portion of the stomach is removed. The part of the stomach that is removed is the part that produces the hunger hormones and is also the part that expands to accommodate the food that you eat. So with a much smaller stomach and no hunger at all, you're able to eat smaller amounts of food, creating a caloric deficit that allows you to lose massive amounts of weight that is sustainable in the long term. Will you get enough nourishment if you do a VSG? Short answer is yes. Because you are consuming less food, your body will turn to your own fat deposits to draw on those stores of energy to sustain you. This results in weight loss over a period of time. However, eventually your body's metabolism will slow down to match your intake of food over time. So you will hit a new steady state where that small amount of food that you're consuming matches exactly what you need to survive throughout the day. And at that point, you stop losing weight and you hit a new balance. Who is the ideal candidate for a VSG? If you have a body mass index or a BMI greater than 40, you immediately qualify because you are morbidly obese. However, if your BMI is 35 and you have one of the obesity-associated diseases such as diabetes, obstructive sleep apnea, high cholesterol, high blood pressure, heart disease, then you would qualify for a VSG because not only would you be curing the obesity, but you also are giving yourself the best shot of curing one of these associated diseases. With the VSG, you can lose anywhere from 70 to 90% of your excess weight. I have, however, had persons lose 100% of their excess weight and gone down to a normal BMI. In one instance, a patient has lost 160 pounds after VSG surgery. Your insurance will usually cover the VSG if you have an obesity-associated disease such as diabetes, high blood pressure, obstructive sleep apnea, and high cholesterol. There are several factors that determines whether or not you opt for a gastric bypass or a VSG. If you are diabetic, you have a greater chance of curing your diabetes with a bypass. If you have reflux disease, we may opt to do a bypass instead of a VSG, as that may also cure your reflux. Some persons may want the simplest surgery with the least side effects, and that would be the VSG. For persons with a high BMI, they may have greater weight loss if they do the gastric bypass as opposed to the VSG. However, a personal consultation is the best way to find out which one of the procedures is the right one for you. The VSG is not a quick fix. It is a part of a lifestyle change. Part of that lifestyle change is that you must include some physical activity in your routine. This will aid with your weight loss and help to sustain the results of your weight loss years to come. One of the most common side effects of the VSG is that of acid reflux. This is due to the increased pressure within the small stomach tube. This can be treated with medication to decrease the acidity in your stomach and also by adjusting when you eat before sleeping. In order to ensure that you are mentally and physically ready for surgery, you will be required to see a number of specialists on our team. They will help to prepare you that you are in the right shape for surgery and your state of mind for the lifestyle changes is optimal. After you transition to a normal diet, you will find that you are able to eat a lot of your favorite foods. However, your portions will be severely restricted. In some instances, foods that are bad for you will be rejected by your new stomach. This is a part of the lifestyle that you will have to accept. To To find out which weight loss option is right for you, contact us via the information on the screen or check us out at www.ilapmedical.com. See you soon.